how medicine has changed over the years and what I think are going to be wonderful opportunities for anyone interested in medicine. So let me start by sharing my screen. Okay, here we go. So medicine is a journey, not a destination. And I'm going to talk a little bit about the various journeys you can take to what I consider to be one of the most fulfilling careers you could possibly have in a lifetime. So when I started my career in medicine, it was very much a male dominated field where there were doctors and nurses and no one else. In my medical school class, there were 150 men and 29 women. What was remarkable is even then, 5% of our classmates were African American. And today, the goal by 2030 is to have 5% of the doctors and pre-meds be African American, which is a goal we long surpassed many years ago. And we even have 3% Hispanic classmates. But again, diversity in medicine has been a huge challenge. Um, and of course, men dominated the field. I love this picture. I'm an OBGYN doctor by day, and I have a lot of other things I do in my spare time, but you can see that there's barely a woman in the room. And as you look at the parents of people in the med school classes, they were pretty much guys in suits, a lot of them white guys in suits. But luckily, things have really changed for the better. I think for the better of patients, because there's massive evidence that patients will comply with recommendations when they come from individuals who they feel understand their culture and who can really understand communication, because in medicine, communication is everything. It's not so much what you know in medicine that matters, is how well you listen to your patient and understand where they're coming from, understand how they express themselves and how they make choices. So I think that the best part of a career in medicine is the ability to help people at their most vulnerable moment in life. And there are even times when you as a provider of healthcare may not even realize or think that it's a difficult time for a patient. But in many instances, life changes that are seemingly extremely happy, for example, having a baby, are also fraught with a lot of life changes. And what's remarkable about being a physician is that you can be a lifeline. The power you have in the medical provider skill is that you have the ability through your words and through your deeds to make multiple people's lives better, to give them confidence, to make them feel that there's hope, even in situations that are dire. So I think that that privilege is something that no one should ever forget. So it takes hard work, persistence, and commitment to something bigger than yourself. I pulled this picture because when I was in college, it always has been very competitive to get into medical school. And when I was in college, I studied in the basement of my dorm room and of my dormitory. This was at Harvard. And that, I don't know what that picture is there on the wall, but that was where I probably spent 50 hours a week or more studying, that little desk with the hard chair. But that's what it takes, the dark room in the basement with the bars on the windows. That's probably metaphorical. And these are some pictures from some of the things I've done in my career. And I think this can show you the joy of kind of the benefit of that hard work. So in the upper left, I'm holding twins that I delivered, whose mom is a doctor colleague of mine. And then on the bottom left, I had three women married to three brothers, and I delivered all their children. And all these children now are probably, there's a set of twins in there, the one in the far back, oops, the one in the far back and the one in the, where'd my thing go? Just a second, it went off the, there we go. The one in the far back and the one in the forward, and the black shirt and that says, I think, Cal and the green shirt are identical twins, but that was my fan club. That was a family, is a family of people. And then that's me doing a C-section in the middle and bringing the baby out with the vacuum, which you sometimes have to do. And that's another picture in the, oh gosh, in the operating room. I don't know why this is leaving my screen, but let me get it, see if I can get it back again. There we go. All right, let's see. And over the course of my career, I've done a lot of different things professionally, and I think all of them have their fulfillment. When you're a clinician and you see patients one by one by one in the office, sometimes you feel like you don't have the kind of global impact. And I think this is really important because we're going to talk a little later about why careers in public health are so important. And the one thing I would say about a public health career is that you impact in populations of individuals, not just one by one. So in the course of my career, I've tried to do other things to kind of have a greater impact. I was a president of the Alumni Association and a few other things, but I also did medical reporting. For 8 years, I was the medical reporter for Mornings on 2, which is still on air, and used to talk about medical topics that were in the news. What was really remarkable about that, and this is another area where providers of healthcare have great value, is, the lay press picks up the most sensationalized stories in medicine, and some of them are wrong. And it's interesting what ends up happening, especially if something since, COVID-19, of course, has dominated the news. But when there are things are calmer, and there are things like studies, for example, that estrogen replacement therapy might cause breast cancer. The articles that lead to these conclusions are published and embargoed in medical journals. Medical reporters have access to these journals. They write their stories. And then typically you'll see this cycle on Thursday morning. That's when all the medical news comes out. And the people who've written the articles are embargoed. They're not allowed to say anything, nor are the people who review the articles. So what ends up happening in the medical press is that the reporters will often speak to doctors or experts who have never read the paper, asking for their opinion about the conclusion of the paper. Now, often when you yourself read a paper, you can see the flaws, you can see why the conclusions may not be completely accurate, but you're flying by the seat of your pants because you haven't actually had a chance to review these things. So this is how some of the more sensationalized stories kind of cut loose. And it's very hard to dial them back because the way medical literature works, 6 months later, the letters to the editor that explain why the study may have been flawed are published. By then, the public already has this idea that the conclusion was correct. And as was the case, for example, in women taking hormone replacement, we couldn't put that genie back in the bottle. And as a consequence, many women suffered needlessly with hot flashes and a lot of health problems that could have been averted if they had only taken hormone replacement at menopause and not been so frightened. So my job was to kind of dispel some of the rumors because I got the embargoed copies of these studies and was able to come on air on Friday mornings and discuss why some of the other conclusions were wrong. It was really a wonderful way to reach really millions of people through reporting. And then this is just another set of pictures. I think, on the upper left is when I was in college working at Hartford Hospital doing a cardiology rotation. And then that was my medical school class reunion. I was very privileged to be on the cover of the Nob Hill Gazette in 2017. And this is, I love the little baby crawling in the corner and the little faces that they drew on this. And I'm showing you this mainly because if you look, you can see the joy. You can see the joy and fulfillment that you also can have with a career in medicine. Oop, I'm sorry, I have my hot corners is betraying me here. So, but of all the jobs that I've had, the one that I find most fulfilling is as a health commissioner for the city and county of San Francisco. So for those of you who don't live here, most cities and counties in particular in the US have health commissions. And the job of the health commission is oversight of every aspect of public health in the county or in the region. And in our case, we have 7 commissioners, of which I'm the only practicing physician. I just printed the one page of the 3 of us, but Dr. Chow has been around for 29 years, remarkable man. Cecilia Chung is a transgender HIV positive woman who brings such sensibility and sensitivity to the issues that are facing LGBTQ individuals, even in a town like San Francisco. And then that's me. So the Department of San Francisco is both a city and a county. And you think Department of Public Health, sometimes you think it's housed in this little building, but we have 8,000 employees and an annual budget of $2.4 billion. Part of that is that we have 2 very robust hospitals, a county hospital that was helped fund by Zuckerberg. So it's called Zuckerberg San Francisco General. The Zuckerbergs from Facebook gave about $70 million to rebuild some decrepit structures there. And then we have the largest long-term care institution in the United States. It's called Laguna Honda Hospital. And if you want to be inspired, there is an amazing book that was written by a woman named Victoria Sweet that's called God's Hotel. And it is a story of individuals who came for care and never left at Laguna Honda Hospital, and of a doctor who, weaving in with her care of these patients who had chronic illness and a lot of difficult life experiences, she went on multiple pilgrimages, including the Camino in Spain, seeking inspiration. And she weaves the religious inspiration with the inspiration she derives from these incredible patients that she cares for. She intended to work at Laguna Honda for 3 months, and she ended up staying for over a decade. So there is always need in the field of public health. There will be jobs and opportunities if you're interested in pursuing public health. And this is a picture. Alice Chen is the woman in red. She now is at the state running a huge division at the California Department of Public Health. And what you see on the board is we work with lean management, and there's a whole structure involved in lean to both inspire, to get input from everyone, even, no matter what their level of responsibility in the organization. And they're talking about what we call a PDSA, which is plan, do, study, and adjust. So I think this is a little blurred, but it's really important. Not only is public health a team sport, but there are so many ways that you can have a fulfilling career and be involved in the realm of public health. You can be a pharmacist, a nurse, spiritual care. I can't underemphasize the importance of that. Social work, case management. We have a dearth of case managers, nutritionists, dietitians. Hippocrates, in however many years BC, said, "Let food be your medicine." And when you look at the problems facing especially the underserved populations in the United States and across the world, food has a lot to do with it. Fast food, and all of the aspects of not only sedentary lifestyle, but the cost of fresh food compared to fast food has led to this burgeoning rate of diabetes and hypertension and obesity, which in turn shortens lifespan. And in fact, in the United States, people under the poverty line live an average of 15 years less life expectancy than people who are middle class. And that's on us. And that's what one of the many things that public health is charged to fix. But even language pathology, occupational therapy, physical therapy, respiratory care, and I would not at all underemphasize the role of nurse practitioners and physician assistants. Going through the career in medicine is a long slog, but when you look at the future of healthcare, who's going to be really providing primary care for the vast majority of Americans? The answer is physician assistants and nurse practitioners. We call them APPs, which I'll use that term going forward. Not only is the training a shorter span, but last year, a blue ribbon panel did a study of the workforce needs for the future for the state of California. And, I think what's pertinent to California is pertinent not only for the nation, but really for the world. And their conclusion was that healthcare has got to be practiced by teams. They have to be horizontal, not vertical, where a doctor is at the pinnacle and everyone else is below. It really has to be a horizontal structure. And the real underpinning of healthcare will be the nurse practitioner and the physician assistant. And I just put together a slide of all of the potential roads you can take for a career in public health. And I'll leave this up for just a second because some of these things are areas that might not leap to mind. And biostatistics, for example, has been absolutely critical for our understanding where COVID is flaring, what might happen in the future. I mean, these individuals have really provided the critical information to help us understand how to make recommendations for vaccines, restrictions, everything that's gone on in the course of the pandemic. Pharmacists have become increasingly important on many levels, not only because they understand the intricacies of medicines, but pharmacy has gotten very complex, and they understand what drugs interact with other drugs. They are sure that dosing is extremely variable for many drugs, depending on the age of the patient, even the gender of the patient, the other meds the patient is taking. And I think more and more pharmacists will be prescribing the medicines patients need, and more importantly, explaining it to them on site. You probably know that one of the huge areas where vaccines have been provided is pharmacies. The pharmacy chains, the big chains in the United States, CVS and Walgreens, have been really important as sites for vaccine distribution, especially for people who aren't part of some big system where they were able to get vaccinated through a Kaiser or something like this. So, I would look at that. Paramedic is also a wonderful profession, wonderful career. So one of the challenges we face in public health is that until this pandemic hit us, the funding for public health had been cut back again and again and again. And as it says in this slide, the system has been starved for decades and has lacked the resources to confront the worst health crisis in the century. I think what's fascinating about what's going on now is that our public health department had to be so focused on all the needs of our underserved communities. And I'll show you in a second, how vast that really has been, when suddenly COVID-19 hit, and now we had to be a public health department for an entire population. We had to open our doors and open our minds to the fact that even insured individuals, everyone in the population was vulnerable, and we didn't have the manpower to be able to kind of absorb this huge population of individuals who now were vulnerable to a life-threatening disease. So this just gives you a sense of how dire this has been. The public funding had dropped dramatically. State and local public health jobs disappeared, and we really were left with a skeletal workforce right when the pandemic hit. And I love this slide. We don't say to the fire department, there were no fires last year, so we're going to cut your budget. But that's what we've done in public health day in and day out. So this sort of shows you how the spending has gone, and it's really remarkable how little money has been put into public health since before the pandemic. And this has been true over time, and particularly true in Republican administrations. The other thing that I think is important in the public health realm is most people have no idea that rural Americans basically live in a medical desert. 20% of the individuals in this country live in what we would call a medical desert. And some of them are urban, many of them are rural. But these are areas where there is a healthcare provider shortage. And this means that if anything complex happens to a patient, they may have to travel miles in order to seek the proper specialty care they may need. So it's critical that we educate individuals in these communities and try to help everyone who has a healthcare degree practice at the top of their license, because there, with all of these wonderful devices, we hear about Apple and Google and all these wearables and so forth. Well, all of those things are for the well-to-do, and they do nothing to help individuals who live in medical deserts, and many of whom don't even have access to broadband. And in the United States, people don't realize more than 50% of the births in the United States are Medicaid. Medicaid is basically public assistance. 48% of the children in this country are on Medicaid. And the problem with Medicaid, it's Medi-Cal in California, is there aren't enough providers. Sadly, these health plans, while available and while expanded under Obamacare, unfortunately do not pay enough to providers for them to be able to stay in practice and also provide the care. So these individuals end up going to free clinics, but mainly to something called federally qualified health centers. And the health centers are supported with funding governmentally, and they're very much clinics. They're very much 9 to 5. And many of them are staffed by individuals who really don't have the expertise to be able to handle complex illness, many of which are really showing up now as people have been vaccinated as much more complex and even dire than they were because people haven't sought healthcare in the past year. So this is what public health departments do. Population health manages different populations and tries to address the needs of our Black African American population with their high rate of hypertension is not the same as the needs of our Asian population, which is skewed into those that are well educated and those that are still impoverished. Primary care, of course, is huge, and behavioral health, mental health is extremely important. It's probably one of our biggest functions right now, because between the opiate epidemic, the behavioral health consequences of homelessness, the behavioral health outcomes of COVID-19 and the tragedies people have experienced, mental health problems that have not been addressed and have been kind of ignored. This is a huge, huge area where we have a great deal of work to do. Jail health, likewise, home health for people who are homebound. And then, as you can see, we spend as much on behavioral health as we do on Laguna Honda Hospital that I spoke of, but the big expenditure, as you would expect, is the county hospital. So we manage all aspects of health, and our teams include people of all different skills. So I want to show you this slide. We're coming down to the end, but this is a really thoughtful slide that really gives you a sense of what is available as a career in public health, but all of the responsibilities and that we see in public health. So, we have to understand belief systems, as I was saying earlier, that helps draw patients out and make them want to seek healthcare. We have to deal with equity. We have to deal with systemic racism. And this is something that we are aggressively approaching in San Francisco. And I think across the country and the world, we cannot do enough to try to address why systemic racism has adversely affected huge populations of individuals who all have the right to excellent health care. Public policy, we have to have an impact on public policy because many of the initiatives are decided and driven not by people with public health knowledge, but by politicians. And if you ever doubted that, I think all you have to do is look and see what the Trump administration did to stymie our efforts to sound the alarm about COVID-19. And you understand how important it is that public health departments are involved in policy. So even individuals that may not want to be physicians, if they get an MPH or they learn about healthcare, they can have incredible effect on the political system in guaranteeing that initiatives that are funded are funded for the right reasons. Then there are living conditions. And, we are responsible for zero traffic deaths in San Francisco. We have a huge social service structure. We are concerned about areas that are proposed for housing that were actually on toxic sites. These are all, and of course, housing the homeless is the first step in improving their health. So we're very involved in that. When you look at health behaviors, it's not just keeping people from avoiding junk foods, but food insecurity is remarkable. 20% of the people who live in an incredibly wealthy town like San Francisco are food insecure. And we have issues where our food banks are not located in areas of where there are food deserts. They're in many cities is a disconnect because there's not space or facilities in areas of people who are food insecure to actually put food. There have been some interesting studies where one of the reasons people buy fast foods is not that they think they'll stay longer on the shelf and the banana will become too ripe. It's that lot of produce that is really healthy, you have to weigh it. And people are so embarrassed that if they get to the checkout stand and they don't have the money or the food stamps to pay for the food and they're with their children, they have to put it back. And the embarrassment of not having enough money to pay for the food causes them to buy things with price tags on them. They did a wonderful study where they bulked a bunch of items like apples and oranges and put a price tag on them, and people bought them. Tobacco use and alcohol, of course, sexual health, with the rising rates of congenital syphilis and chlamydia and sexually transmitted disease, we're involved in that. Even sleep, which we know has a huge aspect on health. So as you look at this, as this slide, I hope that you'll find yourself somewhere here, because there's tremendous opportunity and you can really pursue an area of healthcare that is your passion based on your own personal experiences and your own personal interests. So where do you begin? Well, you, even as a high school student, could look into becoming a community health worker. There are community health worker programs across the country and across the world, actually. And what's wonderful about community health workers are these are individuals who live in a community, they're language competent, and they understand culture. And with practitioners of medical care, especially with the equity issues, we may have all this medical knowledge, but we don't have the cultural competency to be able to translate that into explaining why someone should take a medicine, into really engendering the kind of trust, because trust in the medical system is critical for compliance with medical care. And community health workers are really the linchpin in ensuring that can happen. You can telescope a bunch of academic doctors who defined a condition into a rural community, but that individual will not have the effectiveness to get patients to take treatments or even want to be tested without a community health worker who is basically the translator for this complex knowledge, so that the patient will really want to become involved. So this is who they are. They empower their peers. They have a deep understanding of cultural norms for the people they serve. They link their neighbors to healthcare and social services, and they mobilize their communities. You, as a high school student, can create positive change. The qualifications vary, but some employers only require a high school diploma. So this is something that some individuals do en route to medical school, en route to PA or NP school, en route to another aspect of healthcare. The training is incredible, 100 hours of training and a lot of study. So it's something to think about as a way to kind of dip your toe into the world of a healthcare career. The other area that you can really get involved is volunteerism. So one of the other things I did when I was president of the Harvard Medical School Alumni Association, Obamacare was about to be instituted, and we recognized that there were medical deserts, that it was great to give more people Medicaid insurance, but it didn't mean that they would have access to care. So we decided that we would recruit a group of physicians. A lot of them were retired or semi-retired. And this was in 2012, and we saw the benefit of telehealth. So we recruited a series of physicians, a group of clinics came together, and we basically, through telehealth, advised primary care providers in the field on how to manage difficult or complex medical problems. And so we were available on the spot. When a patient came in and the person seeing them, it was kind of above their knowledge base, they could basically go on a platform, press a button, and a cardiologist, an infectious disease expert, an endocrinologist would be there ready to help. This is a picture of our team, and this is a free mobile clinic in Miami, Florida. And it's one of the sites that we work with. We're now in 12 states. We have 80 clinic sites, and we have 200 doctors who volunteer. It's called the Maven Project for Medical Alumni Volunteer Expert Network. But we do not only utilize doctors, but we have volunteers who are interested in medicine who have helped us in multiple ways, whether it's with our website, with the platform, with being a liaison to clinics, with being translators. It's a really, there are many opportunities like that for even young people at a junior high or high school level. And I guess I want to close by telling you the aphorism that I live by and that I think is the key to happiness. Over the years in medicine, I've seen this field go from where I was a physician to I'm a vendor. You probably have read that medicine has been so uh, uh, dominated now by business. It's really been corporatized in so many ways that it's easy to feel like you're the pawn in the system, that you're doing all the heavy lifting. And then, the drug companies, the insurance companies, the hospital administrators are all sitting there, with their bills, counting their bills. But I once had an epiphany where I was actually speaking to someone who had been a CEO of a health plan. And it dawned on me that he'd been a neurologist, and he took over this health plan and was, a millionaire. And I realized that he didn't have the substance in his heart to get what I got, that you make a living by what you get, but you make a life by what you give. There's an art and a science to medicine. And there was a wonderful quote from Norman Cousins that said, patients want to be looked after, not just looked over. The physician's words are a lifeline, where ultimately it is the physician's respect for the human soul that determines the worth of his science. So I leave you with that. I want to leave you inspired to go forward and understand that regardless of what you choose, what path you choose, you can make a difference. And at the end of your life, that will be the most important thing. That will give you peace, sustenance, and joy. So thank you so much.
Yeah, now if anyone would like to put any questions in the chat, I know there are a few questions there about fast food. Yeah, but before we go into the Q&A, I just want to say, Dr. Green, you gave a really good presentation. I really like the quote at the end. It was really, really meaningful. Do you see the question in the chat that says, what?
Oh yeah, there are 5 chats. Let me go on that.
Yeah.
Okay. What's the thing in fast food that makes it bad? Oh, fructose. So if you read about this, and there are lots of documentaries, Food Inc. is one. I mean, there are many documentaries, but what's happened is the government has underwritten the corn industry. A part of it was allegedly for methane fuel, but what's happened is all of the foods that are kind of high fructose are inexpensive and packaged and full of sugar, and we know that that's an addictive substance. So that's what the fast food. But there are a lot of really good books about it in a movie called Food Inc. Let's see. How would you become an advocate for your patients? Well, you listen. And you never take no for an answer. Medical students can't make decisions, but what they can do is advocate for patients. Just never feel that you have no value. I don't care if you're first year on a job, if you're a community health worker, when you listen and you have something to say, you speak up. And never be shy. You have value. This is a team. We are not, they used to call doctors, and that's why I started with the men. They were M deities. That's what they were, M deities. There are no M deities. They have been purged from the system. Yeah, with the community health workers, just go on the website. The government has a website. I think it's, I'll have to get back to you on that. It's the Americans. If you Google it and look community health workers, there was a guy that ran it that I spoke to, and I'm just blocking on exactly what it's called. It's a subdivision of the government, and they have all the sites listed. do you know where students could look for opportunities in the medical field? Sure. Well, I think that the best place to find opportunity would be looking at what federally qualified health centers are in your area. I think doctors and hospitals are a difficult thing. In San Francisco, we have a church, Glide Memorial, that gives out food. Look at food banks. Just if you just get your foot in the door, it will lead you on the path. But I look at federally qualified health centers. I look at free clinics. They always need help. If you speak a second language, that is unbelievably valuable. Translators are always needed. And then I'd look at food banks. This check got boring during the break. Okay. Yeah. So any other questions?
It's kind of long, so I'll just speak up. So how do you manage like two full-time careers, like being a practicing physician and a public health worker? Like, is it too much, or is it like doable, or like how are the
Well,
hours?
and I'm the founder and board chair of the Maven Project. Well, my kids are grown up, and I work all the time. It's not easy. My average work day is 12 hours. I worked all day. I worked from 6 in the morning to 10 at night yesterday. And it's constant work. But, when you're fulfilled, the time goes by, you don't notice it. So, yeah, this is the other thing, when you choose a career that isn't MD, and one good thing that's changed is that people recognize that to be a good provider, you have to have personal time. So I think the idea, like when I had my kids, I was on call on a Thursday night and gave birth Sunday, came back to work 3 weeks later, full time, night call, the whole thing. That's gone away. And I think that's a good thing.